What are the risks of DBS lead complications in epilepsy? Imagine a treatment that can help reduce seizures by directly stimulating parts of the brain. Deep brain stimulation is such a therapy, but it involves placing tiny electrodes, called leads, deep inside the brain. While this can be very effective for some people with epilepsy, it also comes with certain risks related to the leads and the surgery itself. One of the main risks during the procedure is bleeding in the brain, known as intracranial hemorrhage. This occurs in about 1 out of every 100 cases and can sometimes cause a stroke or lasting neurological problems. Seizures can also happen during or after surgery, usually around 2% of patients, often due to irritation or minor injury to brain tissue during lead placement. Infection is another concern, with risks ranging from 2 to 5%, which may involve the implanted hardware and sometimes requiring antibiotics or even removal of the device. Leads might not be placed exactly where intended, or they could shift over time. This misplacement or migration can reduce the therapy's effectiveness or cause new side effects. Sometimes, the leads or extension wires can break or wear out, which might mean additional surgery to fix or replace them. After the device is implanted, some patients experience neurological or psychiatric symptoms. Adjusting the stimulation settings can sometimes worsen speech, balance, mood, or memory issues, although these effects are not always directly caused by the device. In some cases, stimulation adjustments might unexpectedly increase seizure activity or cause new types of seizures, including prolonged seizures called status epilepticus. Hardware problems can also lead to discomfort, loss of benefit, or sudden stopping of stimulation, which may require further intervention. Like any brain surgery, deep brain stimulation carries risks such as reactions to anesthesia, blood clots, or swelling in the brain. Some patients might experience confusion, temporary cognitive changes, or delirium after surgery, but these are less common. Most complications are rare and manageable with careful surgical techniques and close monitoring afterward. Precise targeting of the electrodes during surgery helps reduce risks by limiting the number of brain penetrations. Patients need ongoing follow-up visits to fine-tune the stimulation settings and check for any issues. Sometimes, additional surgeries are needed to address infections, hardware malfunctions, or lead repositioning. It's important to remember that deep brain stimulation is usually reserved for people whose epilepsy does not respond well to medications, and the decision to proceed involves weighing the potential benefits against these risks. Patients should have thorough discussions with their neurologist and neurosurgeon to understand their personal risk factors and ensure close follow-up care. Overall, while lead-related complications can happen, they are generally uncommon, especially when performed by experienced surgical teams. With proper management, many patients can benefit from reduced seizure frequency and improved quality of life. But always keep in mind that individual experiences vary, and medical advice tailored to each person is essential.